What are my options for treating follicular lymphoma?
Yeah, the treatment option of follicular lymphoma in the frontline setting in the untreated population goes from single agent rituximab from observation. Patients with localized follicular lymphoma, we can irradiate for these patients, and those patients that are truly localized may achieve long-term remissions under with radiation therapy. However, when the disease is spread to other areas above and below the diaphragm or in the bone marrow, the treatment options include from single observation again, from rituximab single agent to more chemotherapy regimens such as bendamustine with rituximab or R-CHOP, as for example. In the relapse or refractory setting, there is no standard therapy. Also, some patients can be observed if there is, advanced stage low volume disease and the patient is asymptomatic. In patients requiring treatment, there is no standard of care, and the treatment options include those with POD24, with progression of disease within 24 months. Treatment options include the use of CAR T cells, a second line of treatment, or also other agents such as lenalidomide with rituximab, among other options.
Yeah, so we can think about many of the options as being sort of, what we call front lines or the initial therapy, second line and beyond. Many of these patients, you'll get out some many different kind of programs of therapy over their, course of the disease. I think for initial therapy, the traditional standard has been to kind of try to observe patients until they just have, really high burden, lymph nodes that are really swollen. There's some special criteria around this. One we use is the Gelf criteria, and basically is measurements of how burdensome, the follicular lymphoma is in the body. And then you look at things like symptoms and what is their other organ function, like kidney, liver function, or, they have heart disease or heart failure or something else that's impactful in that way. Most of the time when we start initial treatment, it's usually a combination of an immunotherapy, which is using antibody-based immunotherapy. Things like rituximab or obinutuzumab are the most commonly used, what we call monoclonal antibodies. And that's usually paired to chemotherapy, and I think most clinicians now tend to stick with a chemotherapy called bendamustine, which is sort of held up in randomized clinical trials as being kind of the most best tolerated chemotherapy in that situation, with kind of the best, kind of long-term trajectories for treating, follicular lymphoma and getting it in a remission. There's a lot of nuances to that kind of idea. Sometimes we'll use rituximab just by itself. If it is a special situation where we think that can be effective for the patient, or we think the patient may have trouble tolerating chemotherapy. I think the other thing out there is exciting clinical trials trying to get us to a kind of routine chemotherapy-free approach. And, I think especially for frontline follicular lymphoma treatment, that may hold a lot of promise to get patients, a very tolerable sort of initial treatment for the lymphoma, and then get them, kind of good long remissions that they can get to the next best thing that hopefully might be curative or at least have less side effects for follicular lymphoma.